Hi guys, thank you for joining me today. My name is Dr. Jyoti Prasad Rajkhowa, Senior Consultant Dermatologist at Cutis Skincare and Cosmetology Clinic. You know, just like a lot of you are fascinated by Dr. Pimple Popper's videos. I get it, those pops can be oddly satisfying. I'm also here to shed light on a skin condition that often gets overlooked. We are going to talk about Acanthosis nigricans, and no, it's not just a cosmetic concern. Think of it as your skin sending you a signal, a bit like a check engine light on your dashboard. It's a sign that something might be off balance inside your body, and we need to pay attention. So buckle up as we go on a little journey under the surface, exploring Acanthosis nigricans, understanding what it means for your health and what you can do about it. Let's get started. Acanthosis nigricans, or AN for short, might sound like a mouthful, but it's actually pretty easy to spot. Have you ever noticed dark, velvety patches of skin, kind of like a really persistent tan that just won't fade? You'll usually find these patches in body folds. Think of areas like your neck, armpits, groin, even your knuckles. Now, at first glance, you might think, okay, it's just a little discoloration, no big deal, right? But here's the thing, it's not just skin deep. Imagine you're peeling back an onion. These patches are just the outermost layer. Beneath the surface, they're telling us a story about what's going on with the body's metabolism and overall health. And trust me, that's a story we definitely want to pay attention to. So why should we care about these dark patches? Well, let's connect the dots. One of the biggest reasons Acanthosis nigricans pops up is insulin resistance. In simple terms, it's like your body's cells are playing a game of telephone with insulin, the hormone that helps your body use sugar for energy. The message gets all jumbled, and the cells don't respond the way they should. Now, here's the kicker. Insulin resistance is a major red flag for type 2 diabetes, often showing up years before the actual diagnosis. So think of AN as a friendly heads up, a chance to take action before things escalate. But it doesn't stop there. Obesity, carrying those extra pounds, and a diet loaded with sugary processed foods can also contribute to insulin resistance, which then fuels the development of Acanthosis nigricans. And if you throw in high blood pressure, wonky cholesterol levels, and a little extra padding around the middle, that's a recipe for metabolic syndrome, often seen hand in hand with AN. Now this is where it gets really important, guys. We're not just talking about individual cases here. Acanthosis nigricans is like a canary in a coal mine for our community's health. Early detection is key. When we spot these skin changes early on, it gives healthcare providers a chance to step in, screen for diabetes and other related conditions, and hopefully prevent those dominoes from falling. Think about it. Catching something early is always better, right? And here's the thing. By tackling obesity, promoting healthier lifestyles, and managing metabolic disorders head-on, right when AN shows up, we're not just treating a skin condition, we're potentially preventing a whole cascade of health problems down the line. Heart disease, kidney problems, vision issues. Those are some serious complications we can avoid. But here's the catch-22. Many people brush off those darkened patches as just a cosmetic issue. That's why it's so important to spread the word, to educate our communities that these skin changes could be a sign to get checked out, to have a conversation with their doctor. Knowledge is power, people. Okay, enough doom and gloom. Let's talk about what you can actually do about Acanthosis nigricans. First things first, get up close and personal with your skin. Take a good look in the mirror, especially around your neck, armpits, and those other folds we talked about. See any of those telltale dark patches? Don't panic. Just make an appointment with your doctor. Remember those blood tests I mentioned? Your doctor might suggest a couple of those, things like checking your fasting glucose and insulin levels. They're like peeking under the hood of your metabolism to see what's going on. But here's the empowering part. You have a lot of control over your health. A balanced diet, think colorful veggies, fruits, whole grains, lean proteins, and ditching the sugary processed stuff can make a world of difference. And don't forget to get moving. Aim for at least 150 minutes of moderate intensity exercise per week. Now this isn't just on you guys. Healthcare providers, we've got a big role to play too. We need to work together. Dermatologists, GPs, endocrinologists, dietitians, to tackle AN from all angles. Remember, it's not just about treating the skin, it's about addressing the underlying issues, those metabolic imbalances that are setting the stage. Follow-up is key. For those of you diagnosed with Acanthosis nigricans, make sure you're getting those regular checkups. Blood sugar, cholesterol, blood pressure, the whole 9 yards. Let's treat the whole person, not just the symptoms. And let's not forget the power of community. Support those local health camps, spread awareness about diabetes, and share this video with your friends and family. Knowledge is power, and together we can make a difference. In closing, Acanthosis nigricans is not merely a cosmetic blemish. It is a visible marker of invisible metabolic disturbances. By paying attention to these early skin changes, we empower ourselves to prevent and manage serious conditions like diabetes, cardiovascular disease, and, in rare cases, internal malignancies. Let us take these signs seriously, promote healthy lifestyles, encourage regular screenings, and strengthen our community's health literacy. Together, we can turn this skin sign into a powerful tool for early intervention and lasting wellness. Thank you for your attention, and I welcome any questions. Dr. Jyoti Prasad Rajkhowa, Senior Consultant Dermatologist, Cutis Skincare and Cosmetology Clinic, Sibsagar, Assam.